YouTube, we are back again. Stefan Hartman, PA, Exercise Science Specialist, bringing you part 4 of my longevity medicine series. This one is on whole body cryotherapy. I'd also like to point out that irondpc.com, your source for direct primary care, is now live and accepting patients, so do check that out. So this is part 4. As I discussed, we've talked about supplementation to enhance lifespan, autophagy, sauna, and now whole body cryotherapy, which we're going to acronymize to WBC. We're going to start with our athletes. So WBC's effect on muscle damage, and there's real science out there. This is no longer pro science, that WBC does help athletic recovery. We see here that 34% decrease in serum total CK in athletes using WBC. So serum CK is a marker for muscle damage. It's more infamously known to be elevated in the CrossFitters who develop rhabdomyolysis. And this is a severe version of elevated CK that can actually cause kidney damage and kidney failure. But in light muscle damage, where we have a bit of an increase in CK, we can treat this with whole body cryotherapy after training. We're seeing here that there's specific mechanisms for why the WBC has anti-inflammatory properties. We see a decrease in IL-6. We see a decrease in cytokines. These are inflammatory markers, and they may sound familiar to you due to the recent, well, we can't say the P word or the C word here because this YouTube video will get flagged. But yes, certain viral diseases increase these inflammatory markers. So before this YouTube video gets censored any further, there may be cause to pause here and think what other applications besides athletes we can use WBC in. We're going to get to that a little bit later. So athletic recovery with WBC. We see here that professional tennis players can improve their shot put accuracy after using WBC after intense training. This is only after a little bit of cryostimulation. Let's move on from the athletes to the disease populations. We're going to talk about adhesive capsulitis, and absolutely terrible conditions. I've encountered it many times working in urgent cares, where a little old lady will come in with her shoulder absolutely inflamed, so painful she can't move it. She doesn't even want me to touch it. It's so bad. She's taking ibuprofen, steroids, nothing's getting better. We see here that WBC can help these patients. We see that only after a couple weeks, 4 weeks of treatments, patients improve both their range of motion, their shoulder function, much better when you compare them to a group that only received physical therapy. Next, we're going to talk about osteoarthritis and even rheumatoid arthritis. We see that WBC helps patients significantly, a 78% improvement in pain scores for patients in osteoarthritis just after 10 days of whole body cryotherapy. We see also patients with rheumatoid arthritis, a 257 patient study. We had patients improving in about 28 joint diseases with just whole body cryotherapy. And this is through different mechanisms, decreased cytokines, decreased cartilage degrading enzymes. So pretty powerful stuff here. Oh, looks like we froze. Let me get myself pulled up again here. Hold on. Where'd I go? File, pull myself up, new video recording. Here I am. Now we're going to talk about one of the most interesting ones. Whole body cryotherapy and alterations of the lipid profile. Now, I was told in school that if a patient has an altered lipid profile, you put them on a statin here. What we're going to see here really changes your entire perspective of evidence-based medicine. We see that whole body cryotherapy can significantly improve triglycerides from a baseline decrease of 108 to 69. We can see HDL significantly improving from 53 up to 63. We can see LDL cholesterol significantly decreasing from 97 to about 72. We can see that the WBC group in another study had a 43% and 52% decrease in their total cholesterol and LDL. Now when we go and compare this to the Lipitor trial, which is a statin drug with known harms, we see reductions of maybe 25 to 61% in LDL with atorvastatin. We can see no clinically important changes in HDL cholesterol. We can see some improvement of triglycerides, maybe 9%. When you compare these two, which is whole body cryotherapy, which is sitting in an ice bath, to using Lipitor, which is a multi-billion-dollar drug that is used all over the world and has been for about 50 years, it's kind of mind-blowing. And it really begs the question, I mean, can we make money off of whole body cryotherapy? No, we really can't. So it's not going to get a lot of press. We're talking about it here on a little known YouTube channel. You're not going to hear this from your average doctor. But yes, we can see improvements in lipid profiles with simple whole body cryotherapy. So very cool stuff. Let's see, the next study here. Safety and contraindications WBC. Yeah, there's a couple. I mean, maybe some people with Raynaud's or heart failure shouldn't be doing this. Neuropathies, obviously you're not going to feel very cold temperatures. You wouldn't want to get too cold. We're going to get into brown adipose tissue. Now, this is a very interesting one. And brown adipose tissue was previously thought to only exist in infants and not to be a real thing in adults. But we see here that it's a very powerful thing. And when we compare this to white adipose tissue, we see that white adipose tissue is more prevalent in the population and it's more inflammatory and is associated with a lot more disease, obesity, diabetes, heart disease, you name it. And potentially, through exercise and whole body cryotherapy, we could actually enhance our brown adipose tissue, which is phenomenal. This could improve many people's lifespans. The mechanisms for this are very interesting, and they've been looking at it on rodent models, and human models, exercise and cold exposure. And they're finding that you can promote increased brown adipose tissue activation and prevalence compared to white adipose tissue. So it is a real thing, and potentially could be a powerful thing if we can harness this in our longevity protocols. So conclusions for whole body cryotherapy. 1. It can reduce muscle damage and enhance recovery in athletes. Pre and post athletic, it reduces inflammatory markers. It improves shot accuracy in tennis professionals, and it decreases lactic acid in swimmers. Whole body cryotherapy plus physical therapy improves adhesive capsulitis greater than physical therapy alone. Whole body cryotherapy significantly improves pain in patients with osteoarthritis and rheumatoid arthritis. Whole body cryotherapy can improve the lipid profile better than Lipitor. That's an impressive statement. WBC is relatively safe with few contraindications, obvious one being cold. Brown adipose tissue exists in adults, compared to white adipose tissue, which is inflammatory and associated with increased pathology. We want to increase brown adipose tissue, and this can be done through whole body cryotherapy and exercise. And this may be a key to reversing many chronic diseases and enhancing longevity and lifespan. I hope you all enjoyed this lecture. This was a pretty fun one, and I'll see you all in the next episode. We're going to try to do these every week, so look forward to a whole host of new content. I'll talk to you all next time. Bye.